Hi, my name is Tom Sollecito. I am a professor and chairman in the Department of Oral Medicine at the University of Pennsylvania School of Dental Medicine. To think that, I'd like to take it back a step, to think that the oral cavity is not part of the rest of the body is simply naive. For instance, you had a problem in somewhere else in the rest of the body, we know it affects the entire body. The mouth being a part of the body is going to have that same effect. Probably the best example of this is somebody who is a diabetic. We know that there's a bidirectional interaction that occurs between those that are have diabetes and those that have gum disease. People that have gum disease that is not well controlled will aggravate their diabetes, and people who have diabetes that's not well controlled will certainly aggravate their gum disease. In many ways, this works with many other types of inflammatory responses, whereby an inflammatory response within the mouth itself can affect other parts of the body. Again, no different than if somebody had an infection in their knee, how it affects the way the person feels, or in fact, the rest of the body. The body reacts as a sole entity. So, some of the warning signs of gum disease are tooth mobility or bleeding upon brushing your teeth. Those may be some of the earlier signs that a patient may pick up. However, it's always best to see your dentist on a regular basis because there are more subtle signs that are picked up by the dentist that the patient may never pick up. And it's important to have an understanding that there is this bidirectional relationship between inflammatory or inflammation that's occurring in the mouth and its impact in the rest of the body. Not only is it important early on to recognize the disease, treat the disease, and reverse the disease to preserve teeth and gums, but it's also important to decrease the inflammatory load that it poses to the rest of the body. Oral cancer is often a very, very challenging problem for patients because in the early stages, oral cavity cancer and even oral pharyngeal cancer is not noticed. There really are very few symptoms associated with someone who's developed an oral cancer. Some of the signs a patient or certainly a dentist may see is a non healing ulcer or a non healing lesion in the mouth. Those lesions, if they persist 2, 3, or even 4 weeks, they need to be brought to the attention of the dentist so that an appropriate diagnosis could be made. Some of the latter symptoms after a cancer's established itself may be associated with difficulty eating, speaking, even pain, although that's often a late symptom of the disease. When we talk about oral pharyngeal cancer, that's cancer that affects the throat, the base of the tongue, the part of the tongue that we really can't see. Often the first sign or symptom is a lump or a mass in the neck area. And patients may notice this while shaving or feeling their neck. Virtually everyone has some level of risk of oral cancer. Traditionally, we understand that oral cavity cancer patients are usually patients that have used tobacco and alcohol, particularly together, because there does seem to be a synergistic effect. Oral pharyngeal cancer is associated with human papillomavirus. As it turns out, many will acquire an HPV in their oral cavity, in their oropharynx. But luckily, most people are able to clear that virus without it forming an oral pharyngeal cancer. And lastly, there seems to be a cancer that is unexplainable by risk. In other words, not HPV related, and not related to carcinogens like tobacco and or alcohol. Unfortunately, we don't really understand why these people are susceptible to lateral border of tongue cancer. And we tend to see this in a much younger population, 30, 40-year-old patients, both men and women, that develop this cancer. But we really don't understand fully the risk factor involved in that particular cancer, because these are cancers that are seen in non drinkers, non smokers, and when the tumor is removed, it is not associated with the human papillomavirus. It's extremely important to maintain good oral health in patients that have any systemic condition, because, again, there is this bi-directional relationship. In patients that are undergoing cancer chemotherapy, patients' immune systems will be weakened, such that if someone has an infection that stems from the oral cavity, that infection can quickly get out of control because our body's natural defenses are down. Patients that also have autoimmune diseases are often on immunomodulating agents that can have really the same effect. In fact, some of the agents that are used to treat things like autoimmune disease, like cancers, and like diabetes, can also have a profound effect in the mouth, both with oral mucositis, meaning like a peeling of the inside of the mouth, as well as adding to dryness of the mouth. When you have significant dryness in the mouth, the patient's often more susceptible to getting dental decay and is also associated overall with tooth loss. So it's quite important that patients do develop good habits, brushing before and after meals, flossing, and probably as most important is to see the dentist during this period of time. Some patients think because they have certain systemic conditions that they may not be eligible to see their dentist. And it's quite the contrary. It's very, very important to develop that habit of seeing your dentist regularly and maintaining good oral hygiene with brushing and with flossing. And if your dentist suggests using a topical fluoride with any patient with some systemic condition. I think it's very, very important to understand this bidirectional relationship. And I keep using this term bidirectional relationship. Perhaps the easiest way of thinking about this is that the oral cavity is just part of the whole. And if you think about it in that context, you all of a sudden understand that disease in the mouth, sometimes without symptoms, can have profound effect on your overall health. So if I have to leave our audience with one main message, and that would be don't neglect your mouth. Understand that it has a profound effect, not only for tooth loss or gum disease, but also has a profound effect on the rest of your body. So I would recommend, once again, seeing your dentist at a regular basis, whatever they determine is important for you to have follow ups, but also maintain a good oral hygiene regimen. And if you can discipline yourself to do that, you should be able to have a lifetime of good oral health, which plays into an important part of your overall health for your lifetime.